Hello, everybody. Welcome to the mid-month meeting of the minds. Today, I have Dr. Sadaf Lodhi, also known as Dr. Sadaf. We are both fellow OBGYNs, and she has a very fascinating focus in women's health, and it's hot. It is important, and I'm so excited to have her talk to us today. Dr. Sadaf, why don't you tell a little bit how we met and how you created your current focus? Because you are a specialist and I want the world to hear what you have to say.
Hi, Swati. Thanks so much for having me on. Yeah, so we met off of LinkedIn. I think you had posted some job that I was interested in back in 2022. Perhaps I think actually we spoke in perhaps it was December of 2021. And there was a job posting in, I think it was pharma. And at that time, I wasn't sure what I wanted to do. I was totally burned out from OBGYN and I was looking to pivot and do something else. So, I reached out to you and you were gracious enough to talk to me. And then I think we just stayed in touch on LinkedIn.
You're right. You're right. Yes. I don't think I realized you were at a burnout phase back then. Tell me more about your practice now. Do you still see patients or do you do office consulting or what do you do? I know you're a menopause specialist, which is important. And you're also in the fellowship of the International Society, I hope I get this right, for the study of women's sexual health. So you are a certified sex coach, is that right?
I am. So I did coaching through Rutgers University, and I don't think there's like an official certification for sex coaching, but I do coach. And I did the course through the University of Michigan on sexual counseling and education. It's a year-long program for healthcare providers. And I became also a Menopause Society certified practitioner. I took a bunch of courses. With the Menopause Society, I also did, a friend of mine had a menopause course, Dr. Rachel Rubin. I took her course. And I did also, I'm a fellow of the International Society for the Study of Women's Sexual Health. So, and I have a podcast called the Muslim Sex Podcast. So I really focus on menopause, perimenopause, and sexual health. That's kind of where I actually pivoted. So I didn't go into pharma. I actually then decided to stick with gynecology. And in fact, I was delivering babies up until July this past year, just this past July, and no longer doing deliveries. Woohoo! I can't stand it. I can't stand
Yay!
doing deliveries.
Yeah.
Yes, so I am just doing gynecology and office based, and I see patients. I have my own private practice in New York, and so I see patients there, and most of the women that come to me are coming for, their midlife transition, they're in perimenopause, menopause, and dealing with hormones and all that stuff. And then I do a little bit of coaching with them as well, because a lot of women in midlife, we know through a study that was published with ISSWSH is that in midlife, women tend to, the most common sexual dysfunction is decrease in libido. And so a lot of women come with alongside all of their hormonal issues that they're having, they also notice they're having a decreased libido. And so we kind of work through that, and we do the biopsychosocial model, which is we focus on biologically what's going on, psychologically what's going on, and then socially what's going on in their relationship to help them out with their libido.
That is fantastic. Yes, menopause is an understudied topic in women's health. Sexual health is understudied as well, and women's libido is the first thing to go with menopause. I hear that from my girlfriends as well. So, tell me a little bit about your Muslim sex podcast. Is that what it's called? Did I say
Yeah.
the correct name?
Yep, yes, you did. So that was kind of a brainchild of both me and a friend of mine. What happened is, again, I think like 2021 was like a very pivotal year for me, because that was the year where I had my burnout and was like, I need to do something else. And that's when I started focusing on sexual health and menopause and got all this additional training in the year of 2022 and 23. And then so in November of 2021, I was on this phone call with a friend of mine, and she and I, she's a lay person, and she's like, wouldn't it be great if we put together a podcast where you were the medical person and I was asking you questions? And I said, yeah, sounds great. Let's do that. And then I was like, well, what should we call it? And she's like, I think we should call it the Muslim Sex Podcast. And I was like, no way. I am not going to be on a podcast called Muslim Sex Podcast. I was like, gosh, what, in my head, I'm thinking about like, what's my community going to say? What are other people going to say? Like, what the heck? This is going to like blow up. Like, what's going on? But, I worked through a lot. I worked through a lot of the thoughts that I had in my own head and my own sex negativity, and came to terms with the title. And now I just own it. It's something that I'm quite proud of because it helps to erase stigma and taboo and shame. And there are lots of places all over the world. It's a global podcast. And so there are tons of places all over the world that people, do not get sex education and, where, or sex may be enshrouded in shame and that it's wrong, it's dirty, we don't talk about it. And so then, they don't have very many resources. And so I love to be the resource that people turn to for science-backed, research-based information, and that's what I provide. So outside of the US, the country that downloads my podcast the most is actually India.
Wow. Oh my goodness. Yes, it is true that discussions on sexual health are considered taboo all over the world.
All
The
over.
US is not excluded.
Correct.
My parents are from India, and my mom told me she just randomly found a book. Otherwise, when she got married, she wouldn't have had a clue what to expect.
Wow.
Um, and I grew up here, so, I had sex ed from the fourth grade, sixth grade, whatever, public schools in Texas. But um, it's a huge area that's deficient in education around the world. So when you
100%.
hit menopause and women have other needs and concerns, and but neither the woman nor the man or the other sex partner has any education on what's going through their body, my goodness, science-based education is so key.
Yeah.
So, what else can you share with us? How can people find this podcast? Where are you? I know you have a phenomenal social media presence. So let's tell our viewers and listeners where they can find you on which channel and where.
Oh, absolutely. Thanks for letting me share. So I'm on all social media. I'm on Instagram and TikTok as Dr. Sadaf OBGYN. I'm on YouTube at the Muslim Sex Podcast and also at FemV Health, which is the name of my practice. My podcast is called the Muslim Sex Podcast, and it's on all streaming platforms. So Spotify, YouTube, Apple Podcasts, any of those, you can find my podcast, and you can always go to my website, which is www.femvhealth.com, and you can definitely inquire, contact us, and find out about information and webinars that we have. I host a lot of free webinars. In fact, some of my webinars that I've done in the past are archived on my website that people can access for a small fee. So, lots of places to get information, and I'm so happy to provide it.
That is just fantastic. I love you're on Spotify, Apple Podcasts. People could listen to you and learn while they're driving to and from work. I live in
Absolutely.
New Orleans, so I don't do much driving, but I know you're in New York City, is that correct?
Yeah, New York. New York.
And so I'm going to New York in a few weeks or in a
Oh,
week for a conference. And
nice.
oh my God, when I look at the commute time, I'm like, but it's only like 10 blocks. Why does it take so long to get there? Anyway, so I think it's fantastic that your podcast is available on so many platforms and that you are streamed all around the world. How many other countries do you have a list, a tab number of
I do.
countries or?
So I don't know offhand how many countries, but I mean, it was even Palestine was even on there that people, were downloading it there, and Saudi Arabia. I mean, really any country you can think of, like Pakistan was on there. To me, what stood out was the fact that it was, India was downloading, and it's always either India or the US. It alternates between the two of them of who downloads it the most. But
I
lots
love
of
it.
countries throughout the world, yes.
That is just amazing. I mean, I think it's great. And how long does your podcast last when you record? Is it live or is it pre-recorded?
It's pre-recorded. I did do one live one, which was streamed on LinkedIn and YouTube and I think Instagram. And that was the one that I did on the guidelines for the genital urinary syndrome of menopause. But for the most part, they are pre-recorded. And they typically, it depends on the topic. Sometimes they're about a half hour to 35 minutes. Other times they go, an hour long, depending on the guests that I have and if there's a lot of topic, if there's a lot of information to cover. So, for example, I recently did one with a doctor out of England, and we talked about hormone therapy after breast cancer. That was a really important topic. And so I think that was closer to an hour. Um, but my episodes vary. Sometimes I'll talk about sexual health, sometimes I'll talk about menopause, perimenopause. I've talked to all different types of clinicians. I had a sex therapist on. I've had on different physicians. I've talked about anxiety and depression. I had somebody on that was a survivor of domestic violence. I had somebody else on that was talked about divorce. Lots of different topics, but typically they're medically related. And so, we talk about sexual pain, orgasm, libido, all of that stuff.
Now, when you were in full-time OBGYN practice, how did this become your niche? Like, how did this evolve? Do you have anything you want to share? Was it just because menopause is the hot topic today that is understudied and you felt like you could make a difference? Any
No. So
any
actually,
insights?
yeah, yeah, yeah. So, when I decided to focus on menopause and perimenopause and sexual health, it was really that I wanted to learn more about topics that I was never taught. So in residency, we weren't really taught about sexual health, and I wanted to know so that I could help my patients. Menopause, perimenopause, again, were topics that I was never taught. The WHI came out while I was in residency in 2002. I was a second year OBGYN resident. And so I didn't learn that much at all, right? So once the WHI came out, they're like, oh, hormones are bad, so we don't give them. And so then we didn't learn so much. The dogma that was like, if somebody absolutely needs it, you need to give the lowest dose for the least amount of time, right? That's what I was taught. So I really wanted to learn what was going on and what, because I myself am in midlife, right? So really, oftentimes when we seek out topics, we're really just trying to help ourselves, help ourselves understand what is going on. So, that was kind of the impetus. Is one, I was burned out. Two, I wanted to focus on topics that I never really got education on. And I just wanted to do deep dives. I wanted to learn more. I wanted to understand so that I could do the same for patients. And my whole goal, my whole why is that I want to empower and educate women throughout the world. It's always been my goal in life to have this global reach where I could empower women on their own health. I know that there's so many communities where women are in the shadows, they're not really given that much power. And so I wanted to put their autonomy, their own health into their own hands. So I wanted to teach them. I mean, granted, my podcast is in English. So, it's not always accessible to people that don't speak English. However, I wanted it to be a podcast that will always be free and just information for people that don't have access.
I love it. I think it's fantastic. You went in pursuit of higher education and you are underscoring a point. As a fellow OBGYN, I know we did not get much training in residency for menopause and very little on women's sexual health, like, lib decreased libido, vaginismus, all
Right.
those
Pain with
things.
sex, right? Sexual
Yeah.
dysfunction. You just don't get that, right?
So it's a very poorly covered topic in our training, and I'm glad to see you devoted time to your self education, and now you're sharing the education, empowering women around the world, and I love it. So thank you. Um, let's repeat your website one more time because do you do any telemedicine or do you just see patients in person
Do.
in your office?
Yes, so I actually have a license also in Michigan where I trained. So I do telehealth for patients in Michigan, but mostly I see patients in person in New York. So that's where I am based, and that's where I have kind of like a brick and mortar office. So mainly see patients there, but I can do telehealth for Michigan. And my website is www.femvhealth.com.
And that's FEMVIE.com, right?
So it's FEMME,
Oh,
V as in Victor, IE, health, HEALTH.com.
okay. Oh, I forgot the French femme. Sorry.
Yeah.
All right. Well, this has been a delight. Thank you so much. And everybody, thank you for tuning in. This is another mid-month meeting of the minds. Look at the amazing power of networking. And we met over LinkedIn, of all places. It works. And we're staying in touch. We've met in real life now at
Yeah.
the National American Congress of OBGYN meeting. And I hope I see you again when it's in DC this coming year in 2026.
Yeah, that's right. That's right. Yeah, absolutely.
All right. Thanks so much, Dr. Sadaf. And shout out to OBGYNs who move the world to educate women all around. Thank you.
Thank you. Thanks so much for having me on. I appreciate it.